Kate. So big welcome to Kate this afternoon. She is coming to us from Gaza. She is the OCA E-Team MedCo, and she's going to explain a little bit about what that means as well and what the E-Team is, and is going to talk to us about her experiences in Gaza. So without further ado, I will hand over to you, Kate.
Well, thank you for having me, everyone. So my name is Kate. I am a nurse and a midwife, and I've been working with MSF since the beginning of 2020, almost 6 years. I did my first few missions. I worked both as a midwife, activity manager and a nurse, and then I transitioned to medical team leader. And I've now been working on the OCA emergency team. I'm on my 3rd year in the emergency team, which is a field-based team, which is under the emergency support desk. There's around 20 of us, and we're deployed very regularly to emergencies, particularly, in the startup phase of new emergencies, or maybe longer term emergencies, but new access for OCA, which has been the case in Gaza. Now I'm working as the medical coordinator, which is just the position that's coordinating all the medical activities, medical programs across countries. Thanks for having me. And I'm going to talk about Gaza today, and maybe just a little bit of background is that OCA has had activities in Gaza for quite some time, actually, predominantly water activities, both water production and water distribution, despite the fact that we didn't have OCA presence in Gaza. So what I'm going to focus on is when we actually had more presence, when we received registration and were able to enter Gaza, as an independent OC, which was in September of last year. So I'll talk about the scale up of our activities, and maybe a bit the outlook for 2026 for MSF in Gaza, which of course right now is a bit of a precarious situation. Okay. So maybe before we launch into what we're doing, I won't go into the background, the context. I think we're all very well aware, but I think something that I find that really important to note, and even today I was talking about it actually with some of the staff in the hospital, is what we really witness and what we hear, and the stories from our team is there's such an orchestrated systemic violence happening in Gaza and in West Bank. And it goes far beyond the kind of violence that we hear and we talk about. And I think it's much easier to quantify and talk about medical data when we talk about people with gunshot wounds and drone strikes and shelling and the destruction of healthcare facilities and water infrastructure. I think that's very easy to quantify. But what we really witness and what we hear from patients and colleagues is really like this sense of dehumanization and the stripping of people's dignities. And I think we can talk about more that later, maybe during the Q&A session. But I think it's really important to note that there's this really orchestrated kind of system. It's very deliberate and in place to make life just basically unbearable. And it's not as clear cut as sharing medical data, but I think it's something very tangible that you feel when you're in Gaza, and it's not really something that I understood at all until I was in Gaza. And I personally find it quite scary that there's such an intent to do that to people. But anyway, on this screen, I'm just sharing some of the photos of living conditions. Even I was in Gaza, from September, October, November. I left at the end of November and I was out for December, and then I re-entered last week on the 30th of December. It was already planned from the emergency desk that I would come back to Gaza when I left. So that was nice to know I would be back. And it looks like maybe I was on the last movement before we had the news about our deregistration. So very lucky to be back. But I entered on the 30th with another MSF colleague who really, was shocked by kind of the photos I'm showing you now. I think from the outside, a lot of people think they're maybe some areas where there's worse destruction or some areas where people are living in tents, and we just see, a snapshot of the worst of it. But it's really all across, Gaza Strip are these living conditions. There's really no place that is, normal. There are tents everywhere down to the water's edge, as you see in that photo there. So it's very, very unbearable living conditions for people. But anyway, maybe more on that during the Q&A session. So super briefly, a quick recap of what MSF is doing in Gaza. So OCB, OCBA, and OCP have been working in Gaza before October 7, 2023. Even before that, it was, a complicated process to get registration and work in Gaza. And the other OCs had quite niche medical activities, I would say. The healthcare system was functioning quite well. They were focused on very kind of niche areas like physiotherapy, mental health, and psychosocial support. That's obviously all changed. So OCB runs standalone primary healthcare centres. They have a field hospital which focuses on surgery, not just trauma surgery, but all types of surgery. They work in Al Shifa Hospital, which is in Gaza City. They focus on wound care in this hospital. They also work in Al Aqsa Hospital in the emergency department, and they've recently added mobile clinics in Gaza City. OCBA as well is running some standalone primary healthcare centres, and will start doing the same with Ministry of Health. OCBA is very maternal child health focused. They support maternity and NICU in Gaza City, and pediatrics, PICU, NICU, and ITFC, which is the nutrition centre in Nasser, which is in Han Yunis, which is kind of the southern area of Gaza. And then OCP are very much focused on what they were focused on pre-October 7, and it's what they're very good at, which is trauma, orthopedics, and wound care with physiotherapy. They have a really comprehensive physio and occupational therapy program. So they're doing that, in an MOH hospital and in Gaza City in their clinic. And they also add those really specialty programs at some primary healthcare centres as well to boost the local system that's there. So OCA received its Palestinian registration last year, so we were able to enter Gaza and work. Prior to that, for our WASH activities, our water and sanitation activities, we were able to send an OCA WhatsApp coordinator under OCBA. So they lived with OCBA but ran OCA programs in Gaza, and that has been going since early to mid 2024. And I'll talk about those activities. But since entering in September, we took over a field hospital from OCP. So we have a field hospital which was run by OCP, focusing again on trauma. We've recently phased in pediatrics to that. We support wound care and physio at a Ministry of Health primary healthcare centre, which is a new activity. We started a brand new activity in October in Gaza City, supporting a pediatric hospital. Recently opened a PHCC with Ministry of Health in the northern Gaza, and we continue our water production activities and actually scaled them up. So, I mean, I'm sure you've all heard a lot in the media the last days, but MSF has a very big footprint in Gaza, but it's very much, with Ministry of Health and in partnerships and working together. We have a few standalone MSF facilities, but very few when you compare it to our activities with Ministry of Health in partnership. So I thought I would focus on the water and sanitation activities first, because that's what we've been doing for a really long time here in Gaza. So Gaza is really close to the coastline, obviously, and the water table underground is very shallow. It's only about 3 meters below the surface. So water that's sourced from boreholes in Gaza is very salty. So Gaza had a lot of desalination plants prior to October 7, 2023 to take the saltiness out of the water. But many of those are destroyed and damaged and aren't functioning properly. And then we do have some main water lines, water piping that runs from Israel, but it hasn't been functioning properly. There's been obviously issues with destruction of some of the line and also the deliberate turning off of the line. So since October 7, most of the population hasn't had enough access to water. UNICEF leads the WASH cluster and coordinates WASH activities in Gaza, and they set the standard of aiming to provide 6 litres of drinking water per person per day in Gaza, which is very much like the emergency, threshold, and to have the baseline sitting at the emergency threshold for more than 2 years obviously is not great. So yeah, we saw a big gap in water production and distribution, and I think, well, I think, in my experience, I think that OCA is very strong on this public health approach and recognizing how important water is to health. So super great that we started these activities. So how do we produce water? Well, we have boreholes in the ground, and then that pumps the water up, and the water goes through these reverse osmosis systems, which is what you see on the screen. The reverse osmosis filters the water, so it comes out clean and it has good drinking quality once it's gone through the filter into tanks, and then water gets put into water trucks, and water trucks move around Gaza distributing water to people. Not only do we do it at this community level, but we also have these reverse osmosis, little baby reverse osmosis plants and hubs that we can put in healthcare facilities as well. So directly at the side of a hospital, rather than relying on trucks coming, we can install these so the hospital can produce its own clean water whilst providing healthcare, which is great. It's quite, specific, way of producing water. So we have like a fantastic team who are very good at the technical side of maintaining these reverse osmosis filters, but really big challenges with bringing in spare parts, and then even actually bringing in the reverse osmosis systems themselves. We still have, I think, 4 more big systems sitting in Egypt for many, many months, and we haven't had permissions for them to enter. So that's a real shame, but we hope eventually they will enter. So we faced a lot of challenges, in 2024 and most of 2025 in producing water and distributing it because of the security situation, obviously. And OCA experienced a lot of challenges. We even had an incident where our water truck was targeted by IDF and was shot at multiple times, and a 4-year-old girl who was collecting water was shot but survived. But it's been really difficult for the team whenever there were forcible displacement orders to evacuate an area. If we had one of these reverse osmosis plants, the team would actually, with the trucks, try and load the reverse osmosis systems onto trucks and evacuate them as well, so we wouldn't lose them, knowing that how hard they are to bring into Gaza. So it's been a super challenging time, but yeah, there's some of the team there working at the borehole and setting up new reverse osmosis hubs. We were able to really significantly upscale the activities since the ceasefire, which took place on October 9, which is great. So now we have a lot of these new reverse osmosis hubs. We now have 6 across the accessible areas of Gaza Strip. So from the south all the way to Bet Laia, which is in North Gaza Governorate. So super happy that we're able to do this. And yeah, OCA is a massive WASH actor in Gaza. We provide water, produce enough water for between 10 and 15% of the population every single day. So it's a really big achievement, and our colleagues have done an amazing job at doing this through all the challenges, and then with the opportunity of the ceasefire to really upscale the production. It's very fun, Watson. I've been really lucky to learn more about how these systems work and move around with the team, going generator shopping, for example, with them, because it requires generators for the borehole. So yeah, it's been super great, and to understand more about OCA's, real dedication to public health and making sure people have enough water. One of the big challenges is that we're producing drinking water, but there is also not enough domestic water, and people are only, receiving a small amount of water, 6 litres per day. And so if we think about, the hygiene needs and cleaning needs that people need water for as well, there's absolutely not enough water, and that's reflected in our medical data. We see a lot of skin disease, there's been scabies outbreaks, a lot of watery diarrhea, so we know that people are lacking water in general, not just drinking water. And so on that note, probably since November, we've also tried to add some domestic water activities. So in areas to complement where we're providing drinking water, just to have another borehole with a generator to pump water that is not filtered. It's just water that can be used, straight away for showering and cleaning and things like that, domestic purposes. Unfortunately, we've been able to not implement any sanitation activities. We would very much like to, and we have a lot of supply. We have a lot of latrines in Egypt and Oman for 18 months, not had permission to enter those into Gaza. But yeah. And then the other activity that we had remotely before we entered was in partnership with a local NGO called PALMed, who run medical points across Gaza, and this is one of them. So we've been supporting them all of 2025 and continue to do so now. This is one of the medical points in South Gaza in Al Qarara. It's an area where there are a lot of displaced people from Rafah, and they're providing outpatient care. So super nice that we were finally able to enter Gaza and then join the colleagues there as well. So a little bit of background on OCA entering Gaza. Yeah, I mean, I'm sure you all heard over the 2 years that there was a lot of efforts to gain our Palestinian registration, which was a very long process to do so. However, we did enter before we had Palestinian registration because OCP, MSF France, needed to hand over their modular field hospital. They had some other activities to focus on, some budget constraints, and asked that OCA enter under the umbrella of OCP, so coming under their registration, entering, as a OCP person, for registration purposes, and take handover. So it was a small team of us. It was just 4 of us who came in September. It was prior to the ceasefire, and we entered during the ground incursion of Gaza City. So it's an extremely intense time when we arrived, but this is the modular field hospital that OCP has set up, and this is in the middle area of Gaza. And this is the only area of Gaza, the only governorate that hasn't undergone forcible displacement orders. So Gaza is kind of split into 5 areas. There's North Gaza, Gaza City, the middle area, Deir al-Balah, Khan Yunis, and Rafah. And all those, the 2 areas above us and the 2 areas below us have all, been evacuated at times and then re-accessible and evacuated. Areas in North Gaza, East Gaza, and Rafah in South Gaza remain inaccessible to this day. So OCP set up their field hospital in the middle area, which really made sense because it was where people were displaced to when they were displaced during these displacement order times. And the beauty of a modular field hospital is, as you can see in the photo, it's tents. It's really able to be adjusted, the services inside, based on the need. So it was opened as a trauma hospital in September 2024 by MSF France. And of course, in January 2025, there was a ceasefire. And so, of course, the activities really decreased, and OCP actually moved the hospital, which is another great thing about these field hospitals, is that they can be moved. And they moved it to North Gaza, governorate, and they were going to open it there, and they had it set up, and 2 days later, the ceasefire broke. And that area came under displacement order again, and then the field hospital came back to the middle area. So the hospital itself had quite a story, and the staff had a lot of experience in this kind of crazy period when we arrived. But yeah, it was indeed running as a wound care hospital. It had 60 beds, and very quickly, within 2 weeks of us arriving, we scaled up to 110 beds due to the ground incursion of Israeli forces in Gaza City. A lot more trauma cases and a lot of displacement, so a lot of people seeking healthcare in that middle area. So that is some photos of the hospital. This is how the hospital was. We have many patients, very many cute little kids in there. But I think what was really interesting is during this period of really active conflict in Gaza, it's young men who really carried the burden of violence here. So when the hospital was, overflowing with trauma patients, it was really a lot of men, a lot of adolescents and young men who were very targeted, of course. But of course, we had women and children admitted as well. And then the other photo is the hospital cat. There are 3 little cats in the hospital, and that's the all-staff meeting. And standing next to the emergency coordinator is the cat, who obviously thinks it's one of the staff itself. So it was a pretty at this field level, it was a really great collaboration with OCA and OCP. We had, of course, our normal teething problems as you're doing a handover of a big hospital and staff and moving from working under OCP to OCA. But we had a really great team. It was a really intense period. OCP had to evacuate its team from Gaza City, and staff evacuated from Gaza City to the area as well. The house was extremely full. The hospital was overflowing, but it was, a really, really nice time and really great to see the OCs collaborating. It reminded me very much of my experience in Sudan also, where there are 5 OCs and you're dealing with very intense, medical programs and living conditions. And it was really great to be so collaborative and work together. So that's just, some of the team in those photos. We entered at a very intense time, as I said, during the ground incursion, and there was it's hard to describe. I've been in a lot of conflict zones, but it was just a whole nother level here in Gaza, particularly. I think drones are very disruptive. They move so close to you, and with really this kind of pitch that's very irritating to people's hearing. And about 2 weeks after we arrived, we had a critical incident in Gaza where, on the way to the field hospital in the morning, 5 of our staff were waiting at the bus stop, and there was a drone strike very close to them. And unfortunately, two of the staff members died, and a physiotherapist and an occupational therapist, and 3 others were injured and also in hospital. So it was really obviously a super devastating time. And I really felt for OCP during this time to lose staff and then be handing over a hospital, which obviously they were very attached to and very passionate about. And I'm glad that we were here to be, I don't know, an extra set of hands around. But it was a super difficult time. And then days later, we reached a ceasefire, which was, again, it's just a very emotional up and down and period the first month here in Gaza. So this is just some cute pictures from the hospital today. Things are still really terrible in Gaza, but maybe there's just a little bit more lightness and a bit more ability to do some nice things, without the constant, drones and planes and strikes and bombing. And we have a very passionate maintenance agent who loves doing the garden in the hospital. So where we're at now is that, OCA has indeed received its Palestinian registration. The staff have moved on to OCA contracts, which is great. And of course, we are now like 3 months into the ceasefire. Our admissions for trauma are very, very low now. And it's winter and there's a lot of sick kids. So we've actually transitioning to pediatrics. So we're going to be a pediatric hospital soon. We've added 30 beds and we continue to upscale pediatrics and downscale. The team is super amazing. And the other component is this is a standalone facility and we're transitioning to going into co-management with the Ministry of Health. We see that as a much more sustainable option to be partnering with them, to have Ministry of Health staff working with us. So we're moving, in really positive steps in the field hospital. That's the field hospital. And then I wanted to touch a bit on Gaza City. So I'll try and be quick. I didn't realize that I've already talked for half an hour, sorry. So Gaza City was obviously inaccessible when we arrived. OCBA, OCP and OCB all had activities there and they all had to evacuate at the end of September. Ceasefire was declared on October the 9th. they say that at least 500,000 people were displaced from Gaza City to the middle area. Well, after the ceasefire happened, we knew that people would slowly return, and we knew that there was part of the population who had stayed in Gaza City despite the ground incursion. And so as OCA, we decided to do an explo to go up and assess the needs. It took a bit of brainstorming with the team. We knew that we couldn't just go and look for general medical needs because everything is a need in Gaza related to health. Any programming is relevant and needed. But what we knew from the other OCs and talking with the Ministry of Health was that prior to the ground incursion, there had been very little support to paediatrics, so to children's health in Gaza City. So on this first assessment visit, we decided to look at facilities that had been providing paediatric healthcare or would be providing paediatric healthcare once reopening. So we went up to Gaza City, which was very much a ghost town. We went, I think, 5 days after the ceasefire with a small team, and we visited 3 hospitals that day. And the first one we visited was Al Rantizi Hospital. This is the Ministry of Health hospital. This is the southern side of it, the front entrance, which was intact. However, the back of the hospital had been targeted and you can see really unusable. It was full of rubble, and very sadly, this hospital had been targeted earlier in the conflict and had been rehabilitated, this back area of it. And these departments had reopened in August of 2025, and then they were destroyed again in September, 1 month later. So yeah, that's some photos from during our first visit. The oxygen plant was destroyed, which is those tanks that you see in the photo there. But it was quite, inspiring to meet the hospital director there, an older doctor who had retired and then come back out of retirement during this conflict to work again. This is the inside of the hospital. And yeah, we met him there. He had a small team and he said, we're going to reopen this hospital. We need to. It's the only pediatric hospital in all of Gaza, which is true. There are obviously children's departments in other Ministry of Health hospitals, but this was the only structure that was dedicated just to children. So it was, really, really great to meet him. So that was the front half of the hospital that you saw was intact, but still obviously inside needing a lot of rehabilitation. And then the back side of the hospital was just really full of rubble. I wanted to just show you some photos. This is another hospital that we visited that day. And it's just to talk about how amazing the healthcare system has been and able to maintain some really high level services. There's an operating theatre and the neonatal ICU, which they moved into the basement so it wouldn't be targeted. So this hospital had quite a lot of damage, but then when you went into the basement, they had these services running and functioning really well. So just really incredible to see the quick thinking of hospital directors and hospital management to relocate equipment, relocate staff, and still provide essential services. So that's in the basement, and then that photo is upstairs in that same hospital quite incredible. I think something else that was really interesting, we went to multiple facilities, and what we really witnessed, of course, is really not just bombing hospitals, but kind of really targeted, shooting within wards. And I mean, this is a photo of the control panel of a CT scanner that has just been shot. The CT scanner itself looks great until you go to the back of it and you see the control panel. So really sad to see very valuable and life-saving medical equipment being very specifically targeted during this ground incursion when soldiers entered hospitals. So it was really, for me as a medical coordinator to meet with my team and hear from them that what they thought, it was really a no-brainer to help reopen this children's hospital. Ministry of Health and the hospital director was so dedicated to reopening it. We knew it was such a big need. There was only one facility in Gaza City that was admitting children. It was completely overwhelmed and overflowing. So there was really need for another facility. We put together a project proposal and started a lot of work in the hospital. We really focused on, kind of the quick and dirty approach, like do what we can very quickly to reopen it very fast, knowing that there was the winter season coming, and knowing that there would be other development actors who would have funding, you know, for a long period to do that kind of more sustainable rehab. One of the biggest jobs was clearing the rubble. It was more than 120 trucks of rubble that was cleared. Repainting windows and fixing the roof before the winter season. Repairing the oxygen plant, repairing the borehole so there was water. You name it. We jumped on board and got contractors, and our logistics and WhatsApp team were really involved in doing all that. And that's in progress. So when the rubble was gone, it was actually like, that looks much better now. It was really nice to see. The hospital director was really amazing, and we even reopened the emergency room before even it was ready, really, because there was the need. And so while the work was ongoing, we already started opening and seeing patients. Beyond the logistical and WhatsApp support, of course, we pay incentives to the nurses and doctors and all the support departments in the hospital. Obviously, the staff are not receiving their normal salary from Ministry of Health, so that's really important that they receive incentives for their work. And, you know, working on improvement plans with the hospital and making sure they have the supply they need. And then this is the hospital today, so it's like a different place. Really amazing. I went back on Saturday to see the hospital director, and he said to me, do you remember the first day you came? It just felt impossible that we would be able to open the hospital. And yeah, now I think on Saturday they saw more than 300 children in the emergency room, and they had 80 children admitted. So it was something that our team did a really incredible job on. Our staff really worked very hard, long hours, and it's really incredible. It's the emergency department that reopened recently, very, very busy, and working really well. We have a little bit more to do. The hospital was busier than we expected, so we need to do rehabilitation of an extra department, which we'll work on over the next few weeks to open as well. So that's an ongoing activity. And then I guess probably most of you have heard about this yellow line that Israel has of areas that are accessible. When we first went to Gaza City, you couldn't go to North Gaza Governorate. It wasn't accessible at all. It, however, became accessible. So we recently in December went back to North Gaza Governorate, where we had earlier, we had a water production, an RO hub there. So I went there with our WhatsApp coordinator, and surprisingly, despite immense destruction, there is still population returning there. It's hard to describe, but people are living in the rubble of their homes, kind of making caves in the rubble. It's really interesting, but we also saw, okay, let's do something there. This is North Gaza Governorate. It looks like this everywhere you look. There's really no standing structure left, and people really kind of live in these ruins of their home. It's really quite crazy. The first steps we took was for water. I mean, and this is something that we hear from the population and we hear from the staff, and when we talk to people in the community, they just need water to go home. They say if they have access to water, they will live in tents, or they will live in the rubble, but they want to be home where their community is, and they need water. So that was a priority for us to have a reverse osmosis plant, again, functioning in North Gaza. And we've recently opened a medical point in North Gaza. It's temporary because we'd like to open with Ministry of Health a bigger primary healthcare facility, which we will hopefully in February. But in the meantime, we have a small medical point here. UNICEF donated some tents to us, which was super helpful because there was no standing structure that we could have used. And that opened 10 days ago, and we're seeing around 200, 300 patients a day at the primary healthcare centre. So that's our new activity. And then maybe just apart from our activity, I just put some photos in of Gaza. It's an incredibly beautiful place, which is strange because there's so much destruction and really hard to see the way people are living, but it's very beautiful. We live right by the sea, here. But yeah, people just live in unbelievable conditions. I mean, this is an apartment building, and people have put their tents, where their apartment used to be, and then tents where they've cleared rubble. OCP did a survey of its staff in the middle of last year, and 70% of the staff working for MSF were living in tents. So I think everyone is suffering in Gaza. Like people who may have jobs, higher paying jobs or jobs with international NGOs are really not any better than the patients that we're serving. And of course, in this middle area, we see a lot of tents, but in North Gaza, we still see just this really massive destruction, and it's really hard to picture how it's going to be reconstructed. However, look, when I went to Gaza City on Saturday, I hadn't been there for 5 weeks, and it was just incredible to see the amount of people that had returned. Yes, in tents and in rubble, but the city was very much alive compared to the first time, in October, when it was just like a ghost town. And there are markets and there's food, and it's really lovely to see. This is where we live in Gaza. It's very beautiful. It's the houses. We're very lucky to have a house. There are not many houses to rent in Gaza, but we're very lucky to have one. It's very communal living. At one point in that picture, we were 11 women in that room, which was very squashy with one bathroom, but it was a lot of fun as well. And then maybe I just really wanted lastly to speak about our staff. Our staff are incredible. And I think I've been really privileged to be here before the ceasefire and after the ceasefire, and it's different, of course, because we have some more moments to breathe and to eat and to talk about their experience, which is really, really special to hear. And we love to eat together and have coffee together. And the staff, my colleagues have shared with me a lot about the period of the siege, of the famine, when there was no food available. And it does feel, just like such a privilege and a blessing now to be able to share food together. So we do that very often. We try and have any occasion to eat together. This is the OCA team. We had the 10 of us who were there, and that's from November. And then, we have a lot of fun in our days. We move around a lot. It's not like working in a big country like Ethiopia or Sudan. Gaza is so small. You can drive from one end to the other in a matter of hours. So we move around a lot. We're doing a lot of assessments, and the staff are really, incredibly dedicated. It's also obviously been a really uncertain period for them. OCA is new to Gaza. A lot of them worked with other OCs and transitioned to us. So a lot of emotional ups and downs, but we're very lucky to have them. And we're very lucky to have a bit of a more peaceful time with them now. However, with the announcement at the end of December about our registration, we of course now are in a bit of limbo. And it's a lot of concerns on job security for our team, of course, a lot of questions about that. But we're continuing to engage and to continue to seek to get registration to work in Gaza. But we do have to consider the options that maybe we won't be working in Gaza. Once we've been given it's not just us, of course, I'm sure you heard it's 37 organizations, but we've been given the date of February 28 to cease activities. But however, we try and plan for the different scenarios, and we try and do as much as we can now, knowing that perhaps we lose access. But let's hope that we'll continue the work that we're doing here. And that's it, Pam. I think one last photo, and that's that.
Thank you. Thank you.
Sure. Thanks.
I'm going to stop sharing your screen.
I'll try. I don't know how to stop this one. Oh, yeah, got it. There we go.
Yeah. Really interesting and actually really moving as well. We have time for a few questions. So opening to the floor and also online. Anyone? Okay, we've got a question online from Amy. Amy, do you want to turn on your camera and microphone? Can't hear you at the moment.
Can't hear you.
She's saying, maybe we'll come back to her. Yeah, we'll come back to you in a minute, love. Okay, Hannah, online?
Oh, is
Yes.
it? Oh, yes, it is working. Hello, hi, Kate.
Hi.
Thank you very much. That was amazing. I have two questions. I'll be really quick. One is, I see some of the supplies are coming in, whereas we were told that they will no longer be able, supplies and staff will no longer be able to get in. How is that working, or how do you think it's going to work? Is OCA the only one who now can work in Gaza? And then the second question I was going to ask is, in the olden days, it was extremely hard to drive around Gaza. How hard has it been for you now?
Yeah, for the first one, so there's for supply. I mean, to bring supplying people in for 2 years was difficult regardless. We never got all the supply that we needed in at all. But since the 1st of January, we've had no supply and no people enter. So Tuesday and Thursday are the rotations for staff to move into Gaza. So on Tuesday, all MSF staff and all staff from the other INGOs who were announced in that list were refused entry. And then on Tuesday and Wednesday, we had 2 supply shipments and through 2 different corridors from Egypt and from Israel, and both were denied and told that we won't have approval until we are registered. There's another staff movement tomorrow, Thursday, so we're waiting to see. We try again. But we assume now that we will not be able to have people or supply move into Gaza. So, I mean, it's very bleak. It's either we all leave it on February the 28th, or somehow we get registration and people and supply come in. Of course, everyone is working super hard to work out other ways to bring supply in through other UN agencies or NGOs, but super difficult. Maybe to note that you know we all have Palestinian registration, and that's current. This is to do with the Israeli registration, which OCA actually didn't have. So everyone got a stock sent letter saying that your registration has expired, and the ministry that handles INGO registration is now a new ministry, and you have to apply through them. So we all received this letter, but I'm sure you all saw in the media that there's some demands, you know, or some requirements of this registration that these NGOs aren't willing to meet. So yeah, and then sorry, driving around Gaza. So I mean, prior to the ceasefire, there was some areas where it's okay, you can just move, and there are other areas where you have to coordinate with CLA, which is the authorities, the military authority in Israel, to coordinate your movements. But like then the actual practical part of moving around is very difficult. You have all this population squeezed into like the tiniest area, the overcrowding is unbearable. The traffic is insane. Very difficult to move around, even though we were moving around a lot. Yeah, spend many hours on the road. Yeah.
Great, thank you. Okay, Amy, should we try again?
We can try again. Can you hear me now?
Yay, we can hear
A
you.
little bit. It's better. Good. Thank you so much. Thank you so much for that incredible presentation. I'm sure when you said, "Oh, I've been talking for half an hour," that nobody noticed at all. So thank you so much for sharing all of that. I had some really questions around the pediatric hospital that you mentioned that you visited, and that you showed us some just incredible photographs of the aspect from the back when you said, oh, and I was thinking, oh, that well, there might be an opportunity to get that going, and then obviously from the other side it's just a disaster. So I just wondered, and I'm sorry if I missed it, what the name of that hospital was and where it is, please.
Yeah, it's in Gaza City, and it's called Al Rentizi.
Gotcha.
Yeah, Ministry of Health Hospital.
That was the second part of my question. So that's being rehabilitated by Ministry of Health with our support.
Yeah, we've done all the rehabilitation. They weren't able to, but it's staffed by their staff with a few of our staff there as well. Yeah.
Got you. And is it now receiving patients?
Yes, yeah, we had more than 300 patients, and we have a 100-bed IPD open. The Ministry of just general IPD, but they're very enthusiastic to open an ICU unit. You know, they had pediatric dialysis, pediatric cancer center in that hospital before. They're very dedicated to opening these services. And this hospital really suffered a lot. You know, it was really severely damaged twice. I spoke quite a lot with the staff. You know, the core management team stayed in the hospital just during the ground incursion. They were surrounded by snipers. They were under siege. They had patients die of starvation in this hospital, and they had no food during the famine. It's incredible what they've experienced, and it's fantastic that they're still there and able to open again.
Yeah, wow, that's amazing. And you mentioned that the primary healthcare centre that you've just set up, I think it was just the tents from UNICEF that you mentioned. And you said there that we were seeing between 200 and 300 patients per day. Is that the correct figure? Yeah, okay, great. That was just my few things just to clarify. I work in fundraising. I spend a lot of time talking to donors, and the stories that you've just told are something that I really want to share with our donors. So thank you so much once again. And stay safe.
Thank you.
Thanks, Amy. Okay, we have a question in the room. Yeah.
I've got two quick questions as well. One is, how does MSF's work, well, the scale of MSF's work compared to other organisations in Gaza? And are we working with any other organisations kind of hand in hand in anything? Kind of touched on a few things, but yeah, that's the first question. Our second question after this also great.
Yeah, no, it's a great question. I would say like something that's very impressive about Gaza is the international response and other NGOs, which, you know, like within this for safe MSF forum to say in other contexts where you think, oh, they're a bit hopeless, they don't have the funding that they need, are super active here. So there are some other big key, you know, health actors like International Medical Corps, UK Med, who are also, you know, facing deregistration. But yeah, I would say the INGOs are very responsive in Gaza. MSF footprint is very large in WASH, very, very large. And the way that we work so closely with Ministry of Health is probably a bit different from the other NGOs. And again, with you know, the way that we're funded, we're very fast. We're much faster than other people. Yeah.
And then the second question was just, you know, you've covered quite a lot of those setbacks and huge challenges, but something that you've been speaking about so beautifully is this undertone of hope that you have, and, you know, this real nice touch of actually there's a better future and it's coming. And especially from that medical director as well from the hospital. What are those key things that you think for you and your team, or even for your patients and the communities, are those key drivers of hope and looking forward to a new future?
It's a good question. I mean, it is a great question. I think when I don't know, I mean, you have someone from Gaza in the room with you. I think there are a lot of people, I mean, at least from that I talked to, that have lost, you know, hope. And I think the fact that this ceasefire has been sustained now for almost 3 months has given people hope. I think the first 6 weeks of the ceasefire, there wasn't so much renewed hope, but I think that the fact that it's been sustained has given hope. And I think the fact that people could go back to Gaza City, and Yusuf understands it better than I, but I mean, I was just talking to staff today who said that, you know, Gaza City is so symbolic for us, and it's so important to see it alive and thriving again, and even in the rubble that there's life there, and there's food. And you know, they talked particularly about one bakery that reopened, and it was the famous bakery, and the fact that that's open again. So I think there's small things like that which give a lot of hope. But you know, I also say to people, we also talk about how amazing it is, the resilience and the coping strategies. But I mean, people shouldn't have to have resilience against this kind of, you know, life. This is totally unacceptable. You know, what's happened here, and yeah, people are resilient, but they shouldn't have to be, to these conditions.
That's wonderful, thank you. And I love the bakery as well, because it's those little things that those are the little stories where you're like, oh, that feels like the community's open. So Yeah, thank you very much.
Yeah.
Amber?
Just a quick one, sort of obviously the work that's being done is so amazing, but this deadline of the 28th of February is looming. And I'm sure there are conversations happening about if we are deregistered, what support we might be able to offer despite that. So even if we have to pull out, you know, would we still be able to support hospitals financially? Or I was just wondering about that.
Yeah, look, we know from the experience of UNRWA and Save the Children, who are both deregistered, it is possible to run activities remotely. There is still ways to make financial payments, and there are ways to bring supply in. You know, and I don't envy those people who are very high up in our organization who have to make that decision, but there is a principled decision, right? As in, do we accept that as an indefinite future for the way we work in Gaza, you know? And I think those kind of conversations are happening now. But is there a remote management possibility? Definitely, and that's definitely something that's one of the contingency plannings that we're looking at and how that could work. Yeah.
Good to hear. Thank you.
Yeah.
Hi, Kate, thank you so much for that. I also work in fundraising and talk to a lot of our donors about what's happening, so it's really helpful to hear. Just a follow-up from Amber's question. I'm just trying to wrap my head around what will happen, because I understand that if we are deregistered, our IMS will be expelled from Gaza, but most of our colleagues are Gazan, they're Palestinian. So I'm trying to wrap my head around, like, what happens? Do they continue on? Like, what does that look like for people? Is there like a layer of protection at the moment that will disappear? Do you have any? I don't know if you can answer that. It's probably impossible to know, but.
Yeah, it's totally impossible to know. I mean, we assume that all international staff leave by the end of February. And this is a conversations, I guess, that, you know, the MedCos like me and the MCOs of all the OCs are having with their desks is, obviously we don't want to close our activities. So how, you know, is remote management possible? How would you do it? But I think in a context like Gaza, there's huge duty of care obligations to your team, and I think it's probably a context where having international staff in your healthcare facilities is a layer of protection. To be honest, we've seen very clearly that healthcare workers are targeted, aid workers are targeted. MSF itself has lost 15 staff members, you know, deliberately targeted. So yeah, there's all these kind of big conversations happening. But then throughout it all, there's still a very big push to get registered, right? Without trying to compromise on some things. And there's still a lot of high level discussions going and engagement happening in Jerusalem. So yeah, everyone is asking us that question. We don't know. Plan for the different scenarios.
Okay, I think we've got a question in the chat which we might finish on.
Okay.
That's okay. So this is from Zara, who's sorry she can't be here. She's not very well, but she's working from home. She shouldn't be. Please can you talk to us about how you're keeping yourself sane and safe, how the teams are too, and perhaps the LEAP students in the room can add to this.
That's a nice question. Well, it's a different ball game now. It's but you know, when we first came, it was really tough living conditions, to be honest, for us. But I mean, then you just think about what your staff and the population are living, and it's just 100 times worse. I would say that, you know, my first time in Gaza, it's my second time. It was probably one of the most intense missions I've done in terms of those things. But we had a very small knit, close team, and I think, you know, I don't know, you just. Sometimes you try and stop working and play a game of cards or drink a cup of tea at night. In regards to staying safe, you know, there are mechanisms for NGOs. We can deconflict, you know, give coordinates of where we are, where we're working, and have those sites deconflicted. But yeah, I don't know. It was really, you know, it was very hard, but probably one of my favorite missions. We had a very close-knit team, and yeah, a lot of support to each other, a lot of looking after each other, and I guess just keeping in mind what everyone else is living here. And I think we've said it a lot, and I know I said it already, but a real sense, you know, of privilege to be able to be here and alongside our colleagues and work with them. Yeah.
Did you want to add anything?
Actually, I totally agree with Kate. The social bond in Gaza can support us to deal with that situations. It's like the 8th war we have been through since 2000 and 2000. The first war was in 2000, was called Intifadat al-Aqsa. So since then until now, we are like making adaptation somehow, adaptation with a changed circumstances. It's continuously changed. So today you have a home, tomorrow you don't have. Today I'm gonna live in a tent, tomorrow I'm not gonna live in a tent. Actually, today I have a toilet, tomorrow I don't have a toilet. So it's like changing, currently changing. You have to adapt whatever you have just to keep living, keep fighting, because it's our life. That's what I'm sorry, but we used to live in that continuously changing circumstances. And maybe it's resilience, but I don't totally agree with the word resilience, with the concept resilience, because no one can be resilient to these situations. Actually, to be specific, the last genocide, it's a genocide. It's not a war. It's not a. No one can adapt or resilient with this genocide, because we lost like everything. I used to have a home. I lost my previous job. I lost like 200 or more of my friends and my family. I've lost like everything. We started from ground zero in the war. The genocide start if you have like 100 or 90% of your life. Since it started, since the 7th of October, we started a new zero. It's now we can like start over from the zero. And it was hard. It was very hard. No one can actually get out of this genocide like totally well, or mentally well, let's say, because it was like a continuous complex post-traumatic stress disorders that the people actually living there. But the first and the last thing and the most important thing in Gaza is the social bond. There, everyone knows what you are dealing with. So someone lost his family, everyone will gather with him, just supporting him and doing whatever it costs to like make him feel good. Just all right, to keep his life moving. And that's it. Thank you.
Thank you for sharing. I think we'll wrap it up there. Thank you so much, Kate. That was really great. And thank you all for coming, and thank you for your contribution.
Okay.
And yeah, thanks everybody.
I think you're on mute online.
Thank you.
It's just the one.